You know, we've talked about LASIK surgery a lot here, and the 4 C's are something you need to consider. You know, we've heard the 4 C's when buying diamonds, right? Cut, clarity, color, and carat. But there are also 4 C's when doing LASIK eye surgery. Our LASIK specialist, Dr. John Dishler, has done so many Martino viewers over the last year, as well as friends and family. Let's focus on the 4 C's, Dr. John Dishler. Let's talk about it.
Well, just like with diamonds, we wanted to simplify things and give people the 4 C's. So,
and I think they're very, very important. Credibility is the first one.
Credibility is, of course, key. Picking the right doctor. And, you know, it's just common sense. Pick a doctor that other people recommend. Pick a doctor that doctors refer.
Yeah.
80% of our patients are referrals from doctors. Credibility, check people out, check their credentials, that they have the right experience.
You have more than 200 eye doctors that refer people to you.
Yes, we do, sir.
And your credentials?
I'm a board-certified ophthalmologist. I'm licensed in 2 states. And, you know...
You're a surgeon, a real surgeon.
I'm a surgeon.
When I say a real surgeon, you can do, if you wanted to, eye surgeries of all kinds.
And we have. I've done cornea transplants. I've done cataracts. We understand the full range of eye problems. And it's important when you're evaluating someone for LASIK that you take into account, do they have glaucoma? Do they have cataracts? Do they have retinal problems? So we look at the whole eye, the whole body, more of a holistic approach.
And a little more on that, you opened one of the first, and we'll get into this a little later, but the first surgery center, ambulatory surgical center in Colorado.
One of the first licensed ambulatory surgery centers. We do all of our cases there, you know, and we have much greater control over the environment and therefore less chances of problems.
Why don't we listen to one of your patients on note here? Why don't we do that right now, then we'll go on to the other C's.
Okay.
Super active. I hike a lot. I spend most of my life outside, and it's really hard to do that when you have contacts. I woke up this morning for the first time in my life and could see the room I was sleeping in. So that was pretty exciting. I could actually see the pictures on the wall rather than just a big blurry square, and I could read the alarm clock on the bed next to me, and I could see my phone. Like it was, you know, it's hard to explain how blurry things are, and you just get used to seeing big blobs, and then all of a sudden everything's focused. They knew that they could fix my right eye to 20/20, but they didn't think my left eye would be 20/20, and I'm seeing 20/20 out of my left eye, and I'm apparently seeing 20/15 out of both, which is not what they thought was going to be happening. So, and it's still a little bit foggy, so they're saying it's going to get better. It's going to continue to get better. I've worked mostly with Megan Petratus, who's one of the eye doctors here, and she's been so nice and spent tons of time with me answering all of my questions, and I've never at any point felt rushed or pushed into anything, even though, like I said, it all happened pretty quickly, but they spent so much time with me, and, you know, it's like I walk in the door and they remember my name and they remember my face, and everyone was so excited to see me this morning and so excited that it had gone so well.
That's Nora Simmons. By the way, well, let's go to the other one here now. Cost. The average is about $1,800 to $2,000 per eye.
Yeah, there's no mystery here. The first question people ask is, what is the cost at your center? What's the cost? What's the cost? You know, but the reality is $1,800 to $2,000 an eye for all blade-free custom LASIK. That's what it costs.
For real correction, meaning when you hear these low-priced come-ons, it depends on your correction.
Right, and we charge a little less than this, and in fact, with the special we'll talk about, it's even less than what we're talking about here. But we're so sure, we want to take cost out of the equation. We say, look, we'll give you the lowest price, we guarantee it. Let's not talk about cost. Let's talk about the other C's. Let's talk about the credibility and the other things.
Compare, because for the same correction, the same technology, the same level, there's no way that anyone can do it lower than that.
Bring in a quote from somewhere else, and we'll match it.
And then also, we can say that you also have financing.
Right.
Okay, and interest-free financing, and some conditions apply on that. You need some credit and stuff, but you can call for that. Comfort.
That's the real thing. We've talked a lot about credibility. We've talked about the cost. But I wanted to talk a little bit about comfort, because everyone's really afraid of having any procedure. I'm sure people watching that video are kind of going, you know. But the truth is, we have a very good program. There's no needles. We numb the eyes
Drops.
completely with drops.
Medications.
And
to
the important
calm.
thing is in a surgery center, we can give people the same kind of medications they get at a hospital for other procedures that can make them, and we titrate it. We give them the right amount to make them feel comfortable. We don't knock people out completely, but we make people calm, comfortable, so people feel no discomfort while this is done. And they feel comfortable afterwards. Typically, they go home, take a nap for a few hours, wake up, and their vision's great.
And convenience. Of course, that's where we talk about your surgical center again.
Right.
You
well,
go right to your office.
Convenience is we're a one-stop shop. We got everything there. We're in almost 7,000 square feet up on the 12th floor of a modern building. And so we can make the whole experience very efficient for people. The rides, everything like that, free parking, all those things. But also the convenience that because of the way we do this, the all blade free with the snap flap type technology we use, people can go back to almost all their activities within just a day or two and can go back to doing virtually everything in a few weeks. So there's not a lot of downtime, there's not a lot of visits. It's pretty quick in and out, have it done, and be back to your normal life.
I've talked to many, many patients now over the past year, and one of the first things they say is right out of the recovery room, they just peek. They all peek.
That's okay. We ask them to. We ask them to look at a clock across the wall and say, can you see that?
That
yeah.
famous clock, or I can see my hands, or in some cases, people could not see other people's faces.
Or the farsighted people that look down for the face. See, this is the first time I've been able to read my watch in 20 years, and that it's kind of rewarding. That's the nice part of it.
And they love it. And you've done more than 50,000 procedures. That's a lot. So you do have, of course, the credibility and the convenience, the comfort, the cost. So we have a special, and this is, he's been here for 1 year with us. Of course, he's been doing it for 30 years here in Denver, but you can save $395 on custom bladeless Lasik. Now that's off the already guaranteed lowest price. When you get a new patient Lasik exam, that's complimentary.
Right.
Whether or not you have the procedure done, you come in and if nothing else, you'll know the condition of your eyes. And of course that comes with your consultation, your aftercare for 1 year. No extra charge for custom bladeless technology. They also have 0 down, 24 months financing. Call for details on that. Now this offer with this discount expires July 30th, 2010. They'll still always have the lowest guaranteed price, but this is even better. And this expires July 30th this month, at the end of this month. Dishler Lasik, 303-793-3000. 303-793-3000. And if you look at the website there, it's that simple. Dishler, dish as in a dish, Dishler.com.
Thank you, Tom.